This training video has been produced to enable staff on the Oliver Fisher Neonatal Unit at Medway Maritime Hospital to be fully informed on how to don and doff safely. This training has been in response to the current COVID-19 pandemic. The aim is to prepare staff and to keep them safe. This process may change subject to available personal protective equipment or PPE. All staff will be informed of any updates. Remember, the key to preventing spread is effective and appropriate hand hygiene and by not touching your face. This will help minimize viral spread. You need to alcohol gel visibly clean hands for at least 20 seconds. If your hands are dirty or at the end of doffing, you need to wash your hands with soap and water for at least 20 seconds. This poster demonstrates effective hand washing technique and will be available and on display at all the basins on the unit. This poster demonstrates effective alcohol hand rub hand hygiene technique for visibly clean hands. Donning. You will always don outside the area that you will be entering. You will firstly don your gown. Your buddy will be watching to make sure that you're doing this properly. Your buddy will secure the Velcro and tie the back of your gown. If you wear glasses, you would remove them at this stage, prior to fitting your FFP3 mask. Ensure that your mask is secure on your face. Both elastic straps need to fit securely behind the back of your head. The metal bar across the nose is depressed equally on either side. You can test the fit by breathing in and blowing out hard, covering the vent with the palm of your hand. You will feel for a leak above your nose and eyes and under your chin. If you have taken your glasses off, you will put them back on at this stage. You will then put on eye protection, either reusable goggles as demonstrated here, or a disposable visor. The surgical hat is then put on to protect your head. Lastly, put on a pair of gloves, ensuring that they cover the cuff of the gown. Your buddy needs to ensure that you are fully covered and appropriately donned. Doffing. Doffing is really important, as it is at this stage where the greatest risk of self-contamination occurs. Do this slowly and carefully. Your buddy may need to loosen your gown. There should be no contamination with your clean clothes. You will then remove your gown and gloves. Do this carefully by pulling your gown downwards and away from you, allowing it to fold in on itself. You will then step away, pulling it off together with your gloves, and then place this in the yellow bin. You will then need to clean your hands with alcohol gel for at least 20 seconds. This training video will be demonstrated in real time. You will then remove your hat and clean your hands with alcohol gel again for at least 20 seconds. If your eye protection is disposable, you would dispose of this in the room that you are currently in, and then leave the room and alcohol your gel for at least 20 seconds. However, in this clip, the goggles are reusable, and therefore you need to leave the room to clean the goggles. You will take 2 Clinell wipes and carefully wipe the goggles for 60 seconds and allow them to air dry. The entire surface of the goggles needs to be cleaned, including the strap. On the unit, there is a hook outside the room for you to hang them up. Remember, they are now clean. Clean your hands again with alcohol gel for at least 20 seconds. If you're wearing glasses, you would remove your glasses following this hand hygiene clean, and then wipe your glasses with a Clinell wipe for 60 seconds and allow them to air dry for 30 seconds. You could always pass them to a buddy to hold for you. Following this, you would need to clean your hands with alcohol gel for at least 20 seconds again. You will now carefully remove your FFP3 mask. Carefully lift the straps off your head. Hold the mask and pull it off, stepping away from it and moving it away from your face. Place in the yellow bin provided. Alcohol gel your hands again for 20 seconds. If you are wearing glasses, you will put your glasses back on following this alcohol gel clean. You will now pick up your disposable goggles and take them to the cleaning room. You will leave them on the side in the dirty area, and one of the clinical support workers will then wash them with warm soapy water and leave them on the side to air dry. Once they are dry, they will be placed into a clean plastic bag and labelled and dated as clean. They can then be reused. Following your doffing process, you will then need to wash your hands with soap and water for at least 20 seconds. In summary, always remember hand hygiene and do not touch your face. Your buddy needs to ensure that you're appropriately donned. Doffing is a stage that poses the greatest risk of self-contamination, please be careful. If you have any questions or do not understand anything, please ask for help. And most importantly, please stay safe.